I want to bring in Dr. Adam Brown. He's an emergency physician and the COVID-19 National Task Force Chair at Envision Healthcare. Dr. Brown, always great having you on the show. So Pfizer and BioNTech submitted trial data to the FDA Tuesday for their COVID-19 vaccine for kids that are 5 to 11 years old. As you know, I'm very eagerly awaiting this. Tell us again, what's the difference between the pediatric dose and the regular dose?
Well, first off, I too am very excited about this for a couple of reasons. One, I have two nephews that are in that age bracket, and so I'm excited to see that they could potentially be boosted. And I'm also excited for folks like yourself and some of my friends who have kids in that age bracket as well. Why what's important is we know that kids can get COVID-19 and they can spread it to adults. So this is an important piece of the strategy to reduce down the number of COVID infections across the United States. But to your question about the difference between this dose and the others, is it looks at about a third of the amount of vaccine that would be given to kids as adults. And as one of my pediatric residency attendings once said, kids are not little adults, and they're not. So having the right dosage and the efficacy or the effectiveness and the safety is very important. And what Pfizer has reported is that at a third of the dose, and also having doses 3 weeks apart, just like with adults, that the efficacy or effectiveness is the same. And that is a really, really important thing for us to see as we want to get our kiddos vaccinated.
So help us understand now the timeline. The data has been submitted, and that's just for the Pfizer-BioNTech pediatric vaccine. Are those vaccines already in production? When might we start actually seeing the approval given and those shots administered to kids?
Well, I wish I knew exactly the date of when the approval will be given, but we don't. And so what will happen is Pfizer will make a plea to the FDA. They will present their data and their information to the FDA. The FDA will go through the normal safety protocols of reviewing that information, and then they will make a recommendation of whether or not it can be authorized for utilization for children. So the hope is that this may happen as we head into the winter months. I surely hope that that's the case, but we're going to have to see, and we want to make sure that vaccines, whether they are for adults or children, follow those same type of safety protocols that are there in place to keep us all safe. So my hope is there by the end of fall, heading into the winter, but we'll just have to see.
Okay. Let's shift gears from talking about pediatric vaccine to talking about the booster shots. The CDC reported that symptoms from a third dose of the COVID vaccine boosters are similar to the second shot. What have you heard about patient reactions, and do you have any concerns?
So what I've heard and what I have spoken with my mom and dad who got boosted earlier this week is they're fine, and that they have had very mild symptoms that were mild enough that they themselves could go back to work. When I've spoken to some of my colleagues who have also gotten the boosters, the symptoms have been very similar to after they got their second booster shot, or their second shot rather. And those symptoms typically are mild fatigue, maybe some soreness in the arm, mild headache, those type of things, which are often very common when getting a vaccine. So I'm encouraged by what we are seeing and also by the reports that have been out. We really aren't seeing very severe or worrisome type of side effects from these booster vaccines.
So that's just for Pfizer's boosters, but the FDA is reportedly considering authorizing a half-dose booster for the Moderna shot. What have you heard about this, Dr. Brown?
I'm hearing the same thing there, that Moderna is also going to be putting forth information about a booster shot, but it appears that they are going to be looking at a half dose of their vaccine for the booster. It's important to understand that these vaccines, while they are similar in type, meaning they are both mRNA vaccines, they are slightly different. And so when we are looking as scientists and doctors at creating the most effective medications, we want the medications or vaccines to be the most effective at the lowest dose possible. And so what we're seeing here is exactly the same thing with Moderna, is they have been able to identify that if they give a dose at half the amount of what was originally given, they are seeing the same levels of effect. So I think this is a good signal that we are also going through the appropriate scientific channels, and I'm eager to see what Moderna puts forth and see what the FDA and CDC have to say.
That's very interesting. It'll be interesting to see how a lower dose, the half dose of the Moderna in the third booster, how that might potentially play into side effects, et cetera. But obviously that data is something that we're still waiting for. While I have you, last question. For the first time in months, the CDC is predicting deaths from COVID-19 will actually decrease in the coming weeks. Can you explain what we're hoping is some good news?
Yeah, this is really great news, and it's showing that vaccines work. So while we have seen some breakthrough infections that have occurred for those being vaccinated, what we've also seen is that despite being vaccinated or being vaccinated, you actually reduce your chances of being hospitalized, placed in the ICU, or dying, even if you get infected. And so what we are expecting to see is as the number of those getting vaccinated continue to rise, and as we also see those who are most vulnerable getting booster doses of vaccine, we also start to see a decrease in the deaths. Last thing I'll say too, though, in many of our states like Texas and Florida that saw really high peaks of hospital utilization or cases of COVID, we're starting to see those cases come down. And so carrying that across the rest of the United States, we're hoping to see that will result in a decline in the deaths as well. But we have to watch this closely, Lana, because winter is coming. And as people move from outside to inside, we have to stay vigilant, making sure that while boosters are great, we've got to get those folks who are unvaccinated vaccinated so we can get past this pandemic.
And it's good to see that more people are feeling that way. Dr. Adam Brown, thank you for all that you do and for joining me tonight.